We'll start with a speaker whose name is Dr. Yasmeen Ross. Then we'll have a panel discussion. For those of you who have been joining us for our webinars and or our podcast, we'd like to say welcome again. And for those who are new, welcome and join us. So as we go through the discussions, you will notice that you have both the Q&A and chat box. So if you have any questions, kindly do put them in those various boxes. And as we go at the end, there'll be a question and answer. These questions will be picked up and they'll be answered, or the speaker will actually answer them directly. If we have no time, then later on, these answers shall be forwarded. So now at this point, as we continue, I'd like to allow Dr. Yasmeen Ross to turn on her camera. And I'd like to hand over the floor to Yasmeen, who will talk to us and present to us about the Rabies Public Information Toolkit. Welcome, Yasmeen.
Hi, everyone. Let me... Can you see my screen? Is that okay?
Yes, we can see the screen.
Okay. Okay. Thank you again. My name is Yasmeen Ross. I'm an epidemiologist from the Poxvirus and Rabies branch at the U.S. Centers for Disease Control and Prevention. And today I'll be presenting to you all about the Rabies Public Information Toolkit that we've been working on this past year. So first, as a disclaimer, the findings and conclusions of this presentation are those of the author and do not necessarily represent the official position of the CDC. So there are multiple components to a successful rabies control program, including access to vaccines for people, mass dog vaccination, and public education. The focus of this presentation will be on the educational component. By educating the public on the risk of rabies, we help people make informed decisions about seeking medical attention, dispel common misconceptions surrounding rabies, increasing awareness of the importance of dog vaccination, and promote responsible pet ownership. Media is an amazing tool for public education, as well as raising awareness and advocacy for rabies control measures. However, rabies deaths, outbreaks, and other meaningful community-based rabies issues are rarely publicized. Whether it's fear that rabies will make a government look bad, or just lack of awareness as to how to engage journalists and social media, the majority of rabies deaths go undocumented. You see here just a few news stories that have appeared in just the last month. You'll notice that many of the top news articles are from just one state in India, Kerala. And while it's likely no coincidence, Kerala has also received a substantial community and government support to improve the rabies situation, likely in part attributed to the use of media articles to raise awareness. Our goal was to provide a game plan for governments and other entities that would like to try and replicate this successful media strategy. So this toolkit was designed to assist authorities to raise awareness of rabies outbreaks and reporting strange acting animals, inform the public on rabies transmission and prevention, urge people to go to a clinic if bitten or scratched by a dog or other animal, and to lastly urge responsible pet ownership and promote vaccination. Our rabies communication plan offers an opportunity to provide information about rabies to the community. When tailoring your message, you should consider your target audience. Where do they spend most of their time? How do they normally receive their news? Which platform suits the needs of the messaging that you're trying to convey? Our communications plan template is divided into 3 sections. One is the common high-level talking points. These are used to facilitate clear communication when discussing rabies topics. There's also sample social media postings that can be adapted and used across multiple platforms. And lastly, a sample press release, which are short communication memos that can be easily adapted and disseminated. So when planning an effective messaging after a rabies event, clear, concise educational messaging should be tailored to the event and the goals of the agency preparing the materials. Effective communication during a rabies event hinges on timely and clear press releases. Prior to drafting a press release, you should identify some news sources in your community and compile a list of local news outlets, including but not limited to TV stations, radio stations, newspapers, online publications. And you'll use this list to reach out when you have drafted your press release and it's ready for dissemination. You can save this for future press releases as well. The next step would be to then draft your press release statement. You can use the template included in this toolkit or your own, but be sure to include a catchy headline, pictures, informative text relevant to your audience. And then lastly, you'll disseminate your information. This can be done through an official channel, such as an official website, or you reach out to your news contacts for them to help also push the message. So this toolkit was designed to cover some of the most common types of rabies events and messages that are most often needed for community education. So the first topic covered is rabies deaths in people. The examples in this section can help increase awareness of the risk of rabies in people, and you should use this section when someone dies of rabies in your community. The next section is about rabid animals. The examples in this section are useful to notify community members that they may have had contact with a rabid animal or that they should use increased caution around unfamiliar animals. For example, if there's a confirmed rabid animal in the community or there are community interactions with a rabid animal and you need additional contact tracing for medical treatment. And then the next section are mass rabies exposures and outbreaks. This section is useful to proactively prevent rabies deaths after multiple people were potentially exposed to the same animal or there's an outbreak of rabies in the community. During this stage, you also want to be sure to communicate any response activities planned, particularly if they require community support. There is also a section for bite prevention. This section can be used to proactively prevent rabies exposures, and messaging could be used when there's an increase in dog bites, during seasonal changes, when people are more likely to encounter dogs or bring new dogs into the home, so like around the holidays, and then annually on World Rabies Day. And then lastly, there's a section on general rabies awareness. This section can be used when there's an increase of rabies in animals or people, during seasonal changes when people are more likely to encounter dogs or bring new dogs into the home, and annually on World Rabies Day, or if you just want to send out some additional information about rabies. The last part of the toolkit is an image library. The images here are available for use on social media, press releases, newspaper articles. There are citations as well as links to high resolution versions where available. Just be sure to cite them appropriately. So now I would like to go through an example scenario on how these sections can be combined to create a communications plan. In this scenario, there's a rabies outbreak occurring in your community, and you would like to develop a plan that encourages residents to use caution around unfamiliar animals and to report strange acting animals. Additionally, you'll be hosting a mass dog vaccination campaign in response to the rise in cases. So first things first is your press release. The image here is an example of the press release that's included in our toolkit. So you'll want to choose a catchy title, either from the examples provided, or you can create your own. And then fill in the specific information about your community, including the community name, who's the responsible agency or organization, including their contact information, what species they should be avoiding, what to do if they may have been exposed, and information about the response activities. And you will post this on your official website or any other means of communications. So after you posted this, a local journalist was very interested in the outbreak and would like to craft a news story. So in addition to using the information found in the press release, you can use talking points throughout the news article. So these are just a few examples pulled from the toolkit that highlight the main objectives of your communication plan. All of the talking points are based on current international guidance and what's available in scientific literature. So just for this example, contacting your local veterinary authority if you see a sick or strange acting animal, recognizing the risk of dogs to spreading rabies in humans, and also to notify authorities if there are dangerous animals in your community and not to kill free roaming dogs. And then additionally, communications about the upcoming dog vaccination campaign. So the last component to this communications plan is the social media. So the example here combines images from the image library with the social media messaging. So in this instance, you would find a picture, find the message, and then be sure to fill out the relevant contact information. So the name of the community, any information that you have, so like the number of rabbit animals detected, who you should contact, how to contact them, and then also information about promoting the vaccination campaign. So due to the diverse and often complex nature of rabies exposures, not all scenarios can be covered in this toolkit, but we covered some of the most common scenarios needing public attention. And while rabies outbreaks and human deaths are unfortunate, they offer opportunities for outreach to affected populations and an opportunity to educate the public to allow for community members to make more informed decisions about their health after a potential exposure. The sample communication materials found in this toolkit can and should be tailored to fit your specific rabies situation and community. So don't feel limited to using only one section at a time. You can mix and match messages as needed to best serve your community. And then I would like to acknowledge those listed below from the US CDC, United Against Rabies, and the Zambia National Public Health Institute for lending their time and expertise in developing this toolkit. And thank you again for listening.
Yasmeen, thank you so much for that quick and precise presentation. They had 7 more minutes, but thank you. We'll add those minutes to the next session. So for the next session, I'd like to ask Dr. Terence Scott and Dr. Amos Agyei to turn on their cameras and their microphones. So welcome. So I will start with you, Dr. Scott. Before we hit you with your main questions, from what you've heard, do you think the public information tool would be a useful additional tool in our target to end rabies by 2030, by your opinion?
Yes, thank you very much for the question, and thanks very much, Yasmeen, for the presentation on this wonderful tool. I think it will be fantastic, and is certainly something that we do need driving towards rabies elimination. I think, as Yasmeen highlighted, advocacy, awareness, and sharing that information, the communication aspects of rabies elimination is absolutely critical to achieving that goal of 0 by 30.
Thank you. And Amos, over to you again. Do you think, as a youth leader who's worked in advocacy, from where you've gone before and where you're going to, how do you see this tool being as a support, additional tool for the new youth groups that are coming out?
Yeah, thank you very much, Dr. Mudoga and Yasmeen, for the presentation. I think this toolkit will be very useful, especially to complement the work that has already been done on the ground. And it makes it easier for those in advocacy to incorporate it into their activities. So I think it will be very helpful going forward.
So yeah, and at this point, I'd like to say thank you very much for you and your team for putting this toolkit together. And for the audience, this toolkit will now be officially on the UAR website. So if you go there after tomorrow, you'll be able to find that toolkit. And if you ever have any inquiries, you can always go to the information website link on the UAR to be able to be enabled to how to source and how to work on this toolkit, or to get people to assist with this toolkit. So now we have just come from the World Rabies Day. And as you know, Terence Scott works for the Global Alliance of Rabies Control, who are the lead for this day. So now, Terence, could you inform us who GARC are, what the initiatives are, and if by any chance, has GARC before or present had any initiatives that work towards communication in the eradication of rabies?
Yes, thanks very much for that question. So just to give a brief background, I've seen and I looked at the participant list for the webinar, and it seems like most people will be familiar with the work, but for those who aren't aware of it, as Kavosa mentioned, World Rabies Day is September 28th every year. It's led by the Global Alliance for Rabies Control, which is an international organization and charity that works towards rabies elimination. And we work in partnership with all of the other partners working and all the other stakeholders driving rabies elimination. This includes being one of the members of the United Against Rabies Forum, of which we're all working together to drive that 0 by 30 goal. There are many resources available, I think, from GARC, but also from all of the other members of the United Against Rabies Forum. I think if you look at all of the different resources available, you will be able to find something that very much suits your needs. But I think looking again at this advocacy toolkits that has been created, it's a very nice, easy way to find a lot of the key messages that have been maybe developed in different times and by different groups and stakeholders around the world, and may have been used even by different governments and stakeholders before. But this really brings all of those key messages together in a nice, easy package that can be used in a clear and concise way, so that it really is the one-stop shop that you don't need to now go looking all around and contacting all sorts of different partners to get this information from. So I think this is really highlighting the role of the United Against Rabies Forum in terms of bringing together the expertise and the skills and the resources of all the different partners into a place where it can be easily accessible.
Thank you so much for that, Terence. Now to Amos. Amos, you are the youth leader, and I think still are the youth leader for the Rabies in West Africa Ghana chapter. So now, as a youth leader who has been participating through your college years, and now you're out of college and are still carrying the flag, and one day we'll have to pass it on to the generation about you, can you share some specific examples of you or other youth groups in West Africa, the initiatives that you've used, and how you're networking with each other to effectively communicate about rabies and promote responsible dog ownership, not only to community members, but also to the youth, basically mostly primary and high school students?
Yes, thank you very much. So I think our biggest points as young people in this country and this part of Africa is our participation in rabies control activities. I think our participation serves as an attraction for others to also get on board. But specifically, we've used traditional media as well as new media, social media, and in-person visits to various schools to carry out rabies education. So specifically with social media, we adapted one where we took messages from individuals. So individuals with their pictures and messages about rabies. And what we realized was that people having their images on this information were willing to share and spread the message across to others. It was sort of a drive to get people's attention. And recently, there was one of us who participated in a beauty pageant, and rabies was her message in the pageantry. And I think it brought a lot of attention to the disease in the country. So aside, and also during World Rabies Day commemorations, there's a usual float involving school children. And these school children are able to carry on the message. And once community members see them in the march and they go home, they are able to engage them and ask more about what it was all about, and they're able to spread the message too. So basically, these are things that the youth in Ghana are doing to spread the message.
Thank you so much for that, Amos. And it seems to be quite a bit of fun, and with you people playing around with social media. As the older generation at times get confused with that one. So now back to you, Yasmeen. And looking beyond the public messaging that you're talking about, how else do you think media can engage outside them just being the tools for us, sending the messages out through them?
Yeah, I think other ways the media can be engaged is by establishing partnerships, whether it be with local organizations, veterinary clinics, community leaders, whoever, just to amplify the messages of rabies awareness and using caution around animals. These can be used to organize community events as well, especially when it comes to like dog vaccination drives. They can also organize Q&A sessions so that community members have a forum to get answers to their questions directly.
Okay, thank you for that. So instead of now organizations doing partnerships with media, you're seeing that media too should also try to have partnership with organizations. But it's true, the media have, because of where they are, they literally have a bigger networking with organizations than we do. And we can actually use them if they're helpful enough to be the networking partners for us. So now as we continue, Terence, I'm going to bore you with World Rabies Day. Can you explain to us the context of why World Rabies Day was there, and how dark you see it at present and future, how it can be used to contribute ending rabies, not only 2030 when we want to end the human part, but now further on when now it's going to be eradicating it in other animals and in dogs?
Yes, thanks. I think that's an excellent question, especially in the context of World Rabies Day having just passed recently. I think it plays a massive role because we know that we need to work together. We need to advocate for rabies elimination globally. We need to have better collaboration, better coordination, and we need to be sharing these messages and the information. So again, as Yasmeen highlighted from the toolkits, highlighting that rabies cases are occurring in your community and that we need to work together. We need to vaccinate our animals to protect us against the disease. All of these things are absolutely key and tie in exactly with the vision behind World Rabies Day, and that is to raise awareness, to gain that political will, to advocate for the elimination of the disease, not just the 0 by 30 goal, as you mentioned, where we are targeting the elimination of dog-mediated human rabies deaths, but beyond that, going towards ideally the elimination of dog rabies entirely. So this World Rabies Day, I would just really like to highlight the message is, and the theme this year was all for one, one health for all. And the All for One part is really to encourage bringing everyone together, as we've spoken now, towards a common goal of rabies elimination, and then focusing on that One Health aspect. So talking about bite cases, about rabies cases, about the importance of dog vaccination, about the importance of education and awareness. And again, all of the different things that have been highlighted through this toolkit as key messages. And just, I know I don't want to take up too much time, but just to really highlight that this year, I would like to thank everyone who has participated in World Rabies Day. We at GARC, because we are driving the World Rabies Day initiatives, have seen firsthand the impact and the response this year. And I must say, it has been absolutely fantastic to see so many people around the world who are doing events, who are making a difference, who are joining together to raise awareness and advocate for the elimination of this disease. We've seen that there have been over 320 events registered this year. I think, and I stand to be corrected, but I think that's the best we've ever seen since World Rabies Day has started. And again, just to highlight the importance of getting national stakeholders and country organizations involved. Just to highlight, for example, South Africa, we've seen fantastic engagement from the South African national government and the state veterinarians, where they have contributed alone over 100 World Rabies Day events in South Africa alone. So just showing that, you know, if we can get that political will, if we can get that buy-in from stakeholders, we can really make a huge difference. And we've clearly seen that globally this World Rabies Day, but especially taking that example from South Africa, where we have seen such a fantastic response. You're on mute, Kavosa.
Thank you for that answer. Thank you so much. Now over to you, Amos. Now, this is a question that I'm going to use your African culture. As you know, here in Africa, not only does everything revolve about what we know, but we have the witch doctors, we have the singomas, we have the medicine men, we have the water spirits, the sky spirits, and everything that happens in Africa. Even if we go to school, there are some areas they'll say, no, that was due to the ancestors. So, and we know rabies is one of those diseases that has really been attributed to a curse from the ancestors or an attack of demons. So as a youth, how do you see you can contribute to breaking the cultural barriers, dispelling these myths? And perhaps who exactly in those communities would you need to talk to actually be the forerunners to help you break these traditions and these myths?
Yeah, I think the myths are quite a problem to the progress of rabies control. And I think we can do so by getting closer to our culture, understanding the cultural context in which we find ourselves. And once we appreciate that, we may be able to reach out to those people from the standpoint of our cultural beliefs. Of course, some of the cultural practices and beliefs may not necessarily be antagonistic to rabies control. For instance, there are cultures that eat dog meat. It's a delicacy for them. The very act of eating dog meat per se is not it's not bad in itself, but how the type of dogs eaten, if rabid, is what would cause the problem. So you can't just enter a community and just say no one should eat dog because dogs are responsible for rabies. So understanding these nuances would be able to help us. And once you're able to reach community leaders, that's the traditional leaders as well as the spiritual leaders, we'll be able to drive our message across. And when the message comes from people from these leaders, they'll be able to understand. And if one of them, like someone who belongs to that culture, presents a message to them in the way that they would understand, I think it will be important to clear every myth, at least, if not dispel it all.
Thank you so much, Amos, for that. Before I come back to you, Yasmeen, I'd like to share a question that has been thrown in the question and answer, and I'll give Terence the answer, the first chance to answer, and after Terence answers, I'd like you, Amos, to add to follow up on Terence's question, because you're the younger social media savvy. So now the question is, and it's from a South African, they're asking, do you have any ideas how to encourage liking on social media posts and on rabies? Because I think this person in particular had media campaigns in 2021, 2022, and 2023, but social media does not seem to be interacting with this post. So what ideas would you have? Terence, would you like to go first?
Thank you. I think I may not be the best person to answer that question, but I do appreciate it. I think we've seen similar it's always a struggle to find that initial engagement. And as with everything, whether it's on social media or whether it's engaging with stakeholders in country, it's all about finding the right people to help share and amplify that message. So we've always seen that if you find the right person, or you manage to engage with the appropriate social media account, maybe, then suddenly your messages start taking off, because it's the youth or influencers or people with lots of followers who can pick up the message, and as soon as they do, you then start seeing much better engagement. So in our experience, or at least in my experience, it's very much just about finding that correct person to engage with, and getting them on board to then help you to amplify those messages. And that could be other organizations or groups, private practices, it could be individuals or influencers. I'm not talking about, famous celebrities who have millions of followers, but those micro influencers who have a few hundred or a few thousand followers, can make a huge difference just to get it into the correct audiences. Because as I'm sure everyone here is aware, the rabies world is a very small world. I've been looking through the participants, and I can recognize most of the names on the participant list. And so we need to start getting these messages outside of the rabies circle, and we need to then use those sorts of people to be able to do that. But I have a feeling that Amos or Yasmeen would be able to give a much better answer than that.
So Amos, over to you.
Yeah, I think Terence has said everything. I mean, the rabies world is a very small world. But I think sometimes when you look at the numbers, you may be discouraged with the social media activities. But one thing that one should strive for is consistency. Once you are consistently at it, one day, there's a post that may break the internet, or go beyond your circles. So, and sometimes you may not have much reactions to what you have posted, but the reach may be high. People may not be necessarily commenting or sharing or liking, but you still get people to reach people to read. So whether or not you get engagements, keep doing it. Someone is reading, someone is watching.
So Yasmeen, would you like to throw in your 2 cents on this question?
Yeah, I definitely agree with what's already been said. It's not always about the likes and the reposts and the retweets, as long as you're seeing that message. And yeah, just keep posting stuff, because you never know what'll resonate with someone. Maybe they're just not interested in dog vaccinations, but maybe it's, oh my gosh, someone in my community died of rabies. Now that's something that I'm more interested in and I'm more willing to engage with. So don't give up, just keep posting, being consistent.
So at this point, I'd like to say also from my part is that we found out that some of the social media influencers may not even be in the rabies arena. and they may be in the fashion industry or in the tech industry, but they happen to be dog lovers. So most of them, if you actually get to see them and know them, and you tell them about this information, and they attach your tweets, your social media information out, usually when they pick it up, since many of them have got a larger, wider audience, the messages tend to go out. So now the question is, I'd say, is look outside the box, not people who are within the fraternity, but people who are outside the fraternity but have a love for maybe children and animals. And you'd be surprised how spread this message. And from one of our participants, we got this comment, and one of these participants is from Ghana. And they say that it is very important to get chiefs and elders and traditional leaders, as they do in Ghana, inviting them to be part of the celebrations and sensitization, because people really still look up to these people. So if you get these people to understand your message and the direction you're going, they can easily turn people's minds around. So now, the question, and I don't know who, I think I'll send this to Terence, because I think, and then Yasmeen, you can answer after. And the question is, how much has rabies eradication been taken forward as a One Health agenda? So Terence?
I think hopefully the answer to that question is evident in the theme for World Rabies Day for the last 2 years. So we have very much focused on the One Health approach. We've seen it coming through in many of the international guidelines and documents in terms of looking at improving animal health, in terms of general neglected zoonotic diseases. We have seen rabies and the One Health approach coming far more to the forefront. And I think rabies is often used as a very good example of implementing the One Health approach. And we've seen that in the, I hope I get the name of this right, in the WHO the neglected tropical disease roadmap that was published a few years ago. And rabies is actually mentioned as one of the examples of operationalizing One Health in that roadmap. And so we can see that it has come very much to the fore, and that it is something that is on our minds, because we know that this is something that is essential in terms of reaching our goal of rabies elimination, is that we need to work together in a One Health manner to achieve rabies elimination.
Okay, so Yasmeen, would you like to give us a further input on that question?
Yeah, sure. So kind of in line with what Terence said, we do like to think of rabies, at least within our team, that it's an ideal One Health disease, because it does have that animal and human health aspect. And the coordination between the two groups are very important towards the eradication of rabies. And I will say it will, at least from a CDC perspective, it's always been high on the list of, in the One Health prioritization workshops that our One Health office does. Rabies is always high on the list for these countries. So I think it is a priority for a lot of countries. It's just a matter of having the resources and infrastructure to be able to act on it.
Thank you, Yasmeen. So for the next question, I'll throw it to all of you, but we'll start with Amos, because each of you, from your standpoint and where you've worked from, it will all have it will have a slightly different answer. So Amos, as a youth, as a youth awareness person, and how you've been going out doing communications, how do you monitor the impact of your communication strategies, whether it's social media, TV, or schools? And after that, how do you sit down with your group and see how to improve that communication strategy for the next year or for the next month?
So, thank you very much. So usually we get feedback from right at the spots. Our communication strategy and response from participants usually give us a clue as to how our rate has been. And once we get back for the next one, we analyze our strategies and see which approach to use. But usually we combine a lot of approaches so as not to miss out. As we said earlier, the younger generation is more inclined towards social media and the rest. But there are still others who are very strictly traditional media. And there are still others who cannot be reached through any of this medium unless through community gatherings. So combining all these approaches helps to bring out the best in the situation.
Thank you. So Yasmeen, from the point of where you sit at the CDC, how do you impact your communication? How do you people sit down and actually see how to improve it further?
So I'll speak from a standpoint of when we're like implementing or maybe it's providing technical expertise on dog vaccination campaigns or integrated bite case management. We'll do a lot of surveys. We'll integrate it within our survey or through like a dog vaccination, like our evaluation. We can incorporate questions about, well, how did you hear about this campaign? When did you hear about? How far are you willing to travel to get your dog vaccinated? Things of that sort are helpful. And these are just regular household surveys that you can use outside of like the traditional metrics that are found on like your social media platforms.
Thank you. So Terence, I brought you last because GAC has done quite a lot of communication work over the years and has grown. So from your experience and your memory, how do you know the impact of your communication? How as GAC do you usually sit down and see how to improve your communication for the next step forward?
I think the key thing with that, whether it's through social media, whether it's through in-person communications, irrespective of the communication method, I think the best metric to measure that is the actual engagement. So if you are, as an example, sharing messages about the new toolkits that has just been developed for advocacy, we want to see how many people are actually using that toolkit. How many of those messages are we finding now being used in newspapers or in social media communications that we are then seeing coming through. So I think that while you can measure, especially on social media, there's so many different tools to measure the reach and engagement and the number of likes and those sorts of things. And often those figures look fantastic. But the key is the outputs coming from those communications. So while there may be thousands of likes and shares of a particular social media post, we want to see the 1 or 2 people from those thousands who have engaged, who actually reach out to you and say, listen, we are interested in X, Y, and Z. We want to drive a vaccination campaign in our community because of the messages that we saw coming from the social media accounts or through the newspaper press release or whatever the case is. So even though that is far fewer than what you'd ever see in terms of the numbers from social media engagements and things like that, those are the true outputs that you really measure in terms of the impact of your communications. And that can be taken to the community level too, where, as Yasmeen mentioned, if you are doing a vaccination campaign and you may be educating children, and then the next day you see a child who is now washing their leg or going to tell their parents that they were bitten by a dog. And that's because of the awareness campaign that you may have just done in that community. That's the true impact of the communication, not in terms of how many flyers you handed out or how many social media posts you posted or whatever the case is.
Thank you so much for that, Terence. Now for Yasmeen, a question to you. And this is coming from the ideas when you designed the public toolkit. can you expand for us more how you see community leaders and local organizations, whether small or large, how they can collaborate with the media in response of increasing and helping the awareness and education towards ending rabies?
Yeah, I don't think it matters what size you are. Any organization can reach out. At least I'm also taking it from a American standpoint, where it's easily accessible to find the public or find those media outlets. A lot of people have emails, so it can be just a matter of, hey, can I reach out to you if there's something, interesting going on with rabies in the community? Oh, I've seen that you've posted other stories that are in like the similar realm of public health or prevention or even animal welfare, reaching out to those outlets and just seeing if they'd be willing to collaborate with you or assist you once you have a story available.
Thank you so much for that, Yasmeen. Now a question for you, Amos. Having just graduated from university and being the driver for the youth branch of Rabies in West Africa, from your experience and what you went through, how do you see how governments, non-governmental organizations, and educational institutions, whether they're universities or colleges, can actually help assist you, the youth networks, to harness and pick up and drive this energy that the youth in Africa are now reviving and driving almost everything from climate change to environment to One Health, and use this also to help promoting rabies awareness and advocacy across countries?
Thank you very much. I think from my standpoint, there should be the provision of mentorship for young people coming up in this space. Once the older generation and these educational institutions are able to offer that that mentorship to us, we'll be able to walk in their shoes and do even better. And also education and training. Of course, aside the practical mentorship, I think things are evolving day in, day out. So from the experience of these already established NGOs and educational institutions can provide in-depth training and guidance to the younger generation. Also, recognition and rewards for young people. I think we are motivated when our actions are recognized. So there should be ways to monitor the activities of younger people and find incentives for them to be able to continue in their drive. And also, I think organization of community outreaches should involve young people and policy making. Young people should be engaged when drafting policies, to take their opinions and incorporate them into this. And with an experience from when I was in school, in fact, I got into these rabies activities whilst watching a lecturer who is into this. So his enthusiasm is what drew me into rabies and rabies activities. And for my final year project, I was privileged to be assisted by Rabies in West Africa to carry out a survey in a very rabies endemic community in Ghana. And that information, that research provided a lot of information regarding these myths and more practices regarding rabies. So there can be a lot of collaboration to harness the enthusiasm of the youth as well as our talents and knowledge.
Thank you so much, Amos. I have a question directed to you, Terence, but I'd be happy if you could add a bit of what Amos has answered. But your question is, because I think you're the one best placed to answer this question, is how important is it to have an IEC plan as part of community awareness and eradication?
I think that's an excellent question, and it's absolutely critical. I think as part of the stepwise approach towards rabies elimination, for example, IEC is one of the 7 components, and having a clear IEC plan is exactly one of the activities that needs to be addressed. And we know that, as I think everyone on the panel has already mentioned, is that we need to understand your audience. You need to understand and tailor your messages to different target groups, depending on the community, depending on the situation, depending on, you know, what types of message you would like to get out. And so all of these things are key towards creating an IEC plan. You can go into a particular community with a very good rabies elimination message, but if it's the incorrect message, it will be absolutely useless and you'll be wasting your time. So you really need to have a plan. Again, as Yasmeen mentioned, having focus group discussions, doing surveys, investigating the impact of what you think would be helpful, and then actually understanding what truly will be helpful to the community, and building a plan and a messaging and a campaign around that is absolutely critical.
Thank you so much for that, Terence. And by any chance, from the work you've done, do you have any examples of how you've undertaken this and the success that it brought about?
Yes, I think there are many different examples from all around the world we've seen in different communities. One that just comes to mind, but you know, I'm not saying that there aren't many others out there. Would be in the Philippines, where I know that they worked very hard on focus group discussions, really testing messages in different communities, engaging with the different target audiences, really assessing the impact of those messages first before then going out and creating a much larger scale awareness campaign, building in awareness sort of times such as Rabies Awareness Month, which is in, if I remember correctly, it's March every year. So where they have a whole month dedicated to rabies awareness. So all of these things have come through developing a very clear and sophisticated plan to address IEC.
Thank you. Now the next question, I'll forward it to all 3 of you, because each of you will have a distinct social cultural aspect to the answer. So now we have somebody in the audience who is asking that they know that rabies emerges from the inability to manage dog populations, but they say we human beings tend to have a very good heart and we tend, even if we don't like these stray dogs, something in us just tends to make us to want to feed them. And we tend not to allow council staff who come around to catch them because they say they're our dogs, so leave them alone. But then the issue is that they don't take full responsibility for them. And when someone gets bitten, it's no one's fault. So how do you see it best to communicate with them? And I'd like to start with you, Yasmeen, because I know the American situation is pretty far much different from the rest of the world.
Yeah, it's definitely different than some other countries in the world where we don't have a large stray dog population, and most people are very protective of their dogs and their pets. But it's just about tailoring. I think you need to tailor a message and maybe have some focused communications material just for people that are just feeding community dogs. And just making sure that they're aware of the risk and to use caution. And in the event that maybe that dog does bite someone, the next course of action, what's the best thing? Like, what should they do next?
Okay. So now, Amos?
Yes, I think the concept of stray dogs is quite dicey when it comes to this side of the world, because most dogs that may be described as stray may not be true stray dogs. they may be owned, but just working through the community. When you look at most of our communities, our structures are not walled such that own dogs can be confined to specific compounds. So you see these dogs around. I think one approach we could use to distinguish these once we carry out these vaccination exercises, if we would be able to identify the dogs that have been covered through these procedures, and of course, and also undergoing neutering as part of vaccination exercises, just so as to reduce the burden of the community dog population. I think this would help.
Now over to you, Terence.
Thanks. I think this is an excellent question because it really highlights what we truly see in different communities, and that is different perceptions and different, maybe even cultural approaches or different beliefs and approaches towards what some people consider maybe a nuisance animal in the streets, while others in that same community may see them as the cuddly friends, as you described, Kavosa. So I think going about addressing the issue of these free roaming animals, whether they truly stray, whether they are community owned, it doesn't matter. I think how we need to approach it is in a very understanding way from the perspective of all the different stakeholders within that community. So already, as I mentioned, we see that there may be a conflict between people who are feeding these animals, who may be very heavily focused towards animal welfare. And then on the other side, there would be the people who are looking towards the health of the community, potentially from one of the ministries or from the local municipalities, who are responsible for the health of the citizens and preventing dog bites. And so we need to understand the viewpoint of both of these different stakeholders and try to create a solution that addresses it in a positive way for all of the stakeholders involved. So that is very tricky. It sounds very tricky. I never said that it would be easy, but the point is that conflicts exactly like this are what lead to governments or local municipalities culling dogs, as an example. And then on the other hand, we would then see that the animal welfare activists may become outraged because of this, and that would cause more issues with the community. And this would be a never-ending cycle. And so we need to try look at and address very specific solutions that are amenable and applicable to both stakeholders, so that we can come to a solution that creates safety within the community for both the animals and the people living in that community. So I know that was a very long and vague answer, but we are working on some more resources and tools and courses to help address questions exactly like that, and to help provide a bit more guidance, so that we can come to these amicable solutions.
Thank you so much for that, Terence. Now, as we're coming towards the end, I'd like to open the floor to you, Yasmeen. I know you started with us and you've worked on this toolkit, to give us your last parting shots on where you think we are, where we should we should go, and what you're seeing in the future when it comes to public information, the eradication of rabies.
Sure. So I think we've come a long ways in just the form of informing the public. I think a lot more community members are taking more ownership of their communities and what goes on. So it's a matter of making sure that they're armed with the right information and not spreading any misinformation, or so that way that these things can continue, and just these partnerships with local communities or with organizations and news media they should continue to progress and improve, so that way your reach is expanding beyond what's in just this small rabies community.
Thank you so much for that, Yasmeen. Now over to you, Amos, as a representative for the youth, and we are seeing, as I said, we are seeing the youth not only in Africa, but in, let's say, mostly the Southern Hemisphere, and now the ones driving everything. What, as you, as a representative of the youth, would you like to send us off in the area of where you're going to think the public information systems driven by youth or developed by youth, and what the youth will need, so that the audience here can go off and start thinking about it, so they can see how they can start engaging and supporting their youth?
Thank you very much. I think the youth should not be left behind when drafting these things. The youth should be engaged and be drawn along. In fact, and they should be encouraged to get involved. When you come to this side, in the University of Ghana School of Veterinary Medicine, it's almost a trend that everyone who comes sign up for the rabies educator certificate. So all these things prepare people to be actively involved in these activities. So the more there are of these platforms, the more the young people also be engaged in it.
Okay, thank you so much. Now, Terence, before we have our last moments of enjoying your wonderful smile, can you tell the audience, many of them come for organizations or no organizations who would like to help drive rabies, and especially take part in the World Rabies Day. How, as GARC, can you advise them, or how would you tell them how they can work with you as GARC to push the World Rabies Day?
Well, I think the key thing is that World Rabies Day should not be a single day in the year. It should be something that continues throughout the entire year. So the fantastic momentum that has been built, the huge number of events that have been displayed on World Rabies Day this year so far, the engagement, the advocacy, the awareness raising, all of that should not just stop now that World Rabies Day has finished, and should continue on. And GARC is here. I think the whole UAR forum, all of the members are available to engage and support those organizations, those groups, those stakeholders who are working towards driving rabies elimination at whatever level, at the local level, national level, international level. It doesn't matter whether you are a massive international organization or a single individual who is just trying to drive rabies elimination in your community. Everyone can play their part, and there are all the different partners and stakeholders as part of the United Against Rabies Forum who can support you and who will provide that support to you to drive rabies elimination in your particular communities. So I think that is the true key message here, is that we shouldn't just stop now that World Rabies Day is over. We need to continue this momentum and throughout the whole year, and just reinvigorate it next year on World Rabies Day again.
Okay, thank you very much, Terence. So at this point, I'd like to thank our wonderful audience for coming and being with us. And I'd like to also thank our very lovely panelists, Dr. Yasmeen, Dr. Terence, and Dr. Amos. Thank you so much for agreeing to come and present at this webinar. And we're looking forward as a UAR for your continued participation. We have a question here from an Ali Noor from Hargeisa, Somalia. And he's saying there are more than 10,000 stray dogs around Hargeisa city. And yes, anyone who, and they don't have any rabies vaccination. So Ali, what I'd like to say is I'm sure one of the UAR representatives will pick up your questions. We'll pick up your questions and your request. Maybe you can put your email address, and they can see how they can assist you through the WOHA and any partners around to see how they can continue working forward with you in that area. I know and understand the situation that we have around Somalia, both the social, cultural, and also the resource. So now, thank you, Ali. That question of yours is noted and it is taken down. Okay, so you also need support and capacity building. That is also noted. So the teams in UNR will take in your requests and see from the partner organizations how we can work together to help you. But please do give us and leave with us your email address so we can see how we can move further. At this point, as we draw to the conclusion, I'd like to bring out points that came out during the discussions. Mainly, it came out that media is a very important tool, but is very rarely used and publicized and documented as a tool to use in eradication of rabies. But I don't think it's an eradication of rabies. I think it's almost an eradication, almost all neglected tropical diseases, and also in the drive for environmental safety issues, One Health issues. It's media really needs to be taken as an important tool. And the reason behind this, as Dr. Yasmeen said, is that we really do not know, is it because of lack of knowledge on the point of the media? And if so, then how are we as a community, can we come together and form training and awareness of awareness and knowledge in the media so they can be able to drive our agenda? Or on the other point, is it shyness from countries? And how can we work with countries that they shouldn't be shy about their numbers, but be free to share, because with sharing then we can come together to see how we can help, the way Ali has come out and put down his problem. And as they said, the toolkit is here to help develop authoritative awareness, information on bite treatment and information on bite prevention and how to communicate outbreaks. And the toolkit is also tailored to help those who are using it to give concise messaging, because many times, especially if you're a small organization and you don't exactly have a media or comms person within your organization, then this toolkit can actually help you make concise messages, even if you are a non-comms person. So now this toolkit is mainly targeted for the TV, newspapers, and social websites, any form of communication medium. And I know in some countries, you also, apart from these, you have the community level, what we call barazas or social gatherings. It depends. And apart from that, one of the most important needs for this communication toolkit is when it comes to helping in community education. So now, when it comes to the youth, as we have seen, if we want to get our youth who, in most countries, they're actually the ones who tend the dogs and the ones who will bring the dogs for vaccination and will understand how to be responsible dog owners, we see that most of them are on social media and all the new media platforms. So now, as we're told by Dr. Amos, is how you have to sit down and be able to adapt these stories, not only for the medium, but adapt the stories for how they can understand, and also to look for people who are willing to share. Because once you have a person willing to share, and most of these youth see a person who's similar to them, being able to pick up these messages and adapt them and share them is very easy. And he also gave an out-of-the-box example of how one of the beauty pageant participants, I would believe either at the university level or the country level, in Ghana, her core cause was rabies, which is amazing because most of them, it's women, children, environment. And I believe with that, she's an ambassador. And as I said, it would be beautiful if she can continue carrying this flagship even post her beauty pageant, because you know most beauty pageant participants, they actually still do a lot of work with youth for about 4 or 5 years later on down their line from the competition. And how important it is, especially as Dr. Amos said, to get this education and this awareness at the youth level in secondary and primary school, because at this point, most of these children go home and spread the education. And I know in Latin America, those are one of the education tools and that were used by PAHO, and it really worked a lot. So now one thing we also saw is that we need to start undertaking mentorship in young people so that they can recognize the need, they can be awarded, they can be supported, and to get the youth within the policy making engagement and opinions. And for this, I'd like to say not only the youth, but at times even the everyday citizens at a village level or rural level, as Terence said, when you're making some of these communication strategies or you're driving some of these campaigns, it's best to sit down with the local communities to understand where they come from, what they understand, or what they desire. So when you go out and you do your community awareness, it actually has results instead of it bouncing back at you, because they'll be looking at you like, okay, you're telling us what you want, but that's not ours. So at this point, I'd like to say thank you to all our audience for being with us. We will be having another webinar after this one, and for that, please follow up on our website. You can sign up for the newsletter so you can keep you updated. Apart from that, those of you who have not known, the UAR also has podcasts. If you would like to catch up with the podcast because you have not watched them or you have missed them, feel free to go on the UAR website and you will be directed how and where you can pick up this podcast. And I would encourage you to both undertake viewing of the webinars and listening to the podcast, because they pick up from each other. So it's a continuous story. So between the webinars and the podcast, you actually get a bigger knowledge body and awareness of the directions of where UAR is going, the outcomes in countries, examples of what is happening, and the way forward. So now, at this point, we'd like to invite you all, and I know the email address was posted, the site address was posted in the chat, to visit the website, to access the Rabies Public Information Toolkit. Not only that, there's a wealth of resources, because we know many people wonder where they can have resources from everything from planning, partners, surveillance. And on the website, we've had almost all the partners who've worked over the last 10 years plus on rabies who have willingly shared everything from planning to education materials to surveillance materials, the who, what, and where. And it's a one-stop shop. It is amazing what you can find. For further questions, you can contact the UAR at Global Rabies Coordinator at woha.org. I believe it will be posted in the chat, or you can go to the website and you can also pick up that email address for any further questions, not only on this webinar, any other webinar, any of the podcasts, or any questions you may be having at national level, regional level, or as an organization, and any help you might need towards launching the success of ending human-mediated dog rabies by 2030. And at this point, I'd like to say thank you all. Thank you for all the organizers who helped organize and put this meeting together. All the endless work behind the scenes, following up with the emails and contacting everybody. We'd like to say thank you very much to the back-end team. Thank you to all the supporters of the United Against Rabies, FAO, WHO, and WOHA, who bring this platform together and allow us to be able to share. So from my end, on behalf of the UAR, I'd like to say thank you very much for coming and being with us. And do have a wonderful day, afternoon, or evening, wherever you are, till we see you again. Goodbye. Thank you.